0 will give you your body mass index. Normal body mass index should be less than 24, usually 20 to 24 kg per meter squared. 25 to 29.9, we say the person is overweight. And 30 and above, we say the person is obese. And for obesity, there are also grades of obesity, but I won't go into that because we're not focusing on obesity as a topic today. All right. So that said, you can weigh yourself and then you can do the maths. The weight divided by height divided by height. That's divided by height squared. All right. And then physical inactivity. We are becoming more sedentary. We may be very, very active mentally and in so many ways, but we are becoming more physically inactive. And that is why we intentionally make sure that we move, we keep moving, we do something. Don't just sit. I mean, the average person will get to work by 8:39 until 4:35. I mean, the person may not take even 20 minutes of walking around. May just stand up. Some don't even stand up. All right, that is not good. We've got to make sure that sedentary lifestyle, physical inactivity is dealt with. All right, it is not good at all. You need to move your body. When you do that, there are great benefits. If you don't move your body, if you are physically inactive, your blood vessels will not be as healthy as they ought to be. The chances of vasoconstriction, of getting stiff, is there. Blood flow will not be encouraged. Blood pooling will come in, and a lot of other things will happen. Alcohol consumption is another. All right. Alcohol increases blood pressure. And it's got to be dealt with. Low potassium diet. Where do we get potassium from? From fruits and vegetables mainly. All right. So low potassium diet, translates to those who do not take plenty of fruits and vegetables. Some don't even take it. Some will rather go for all right, instead of fruits and vegetables. And some of us, when we take vegetables, we cook it, we overboil, we overcook. And when that happens, all right, when that happens, you destroy the nutrients because they cannot withstand much heat. By the time you cook for long, they are denatured. They are destroyed, and you cannot use them. Folic acid and other nutritional deficiencies, folic acid deficiency, other nutritional deficiencies, and there are also risk factors for hypertension. Smoking is a risk factor for hypertension. I mean, it will destroy the heart, will destroy the blood vessels, make the blood vessels to constrict. I mean, it does a lot of things. Smoking does not only cause cancer, it can cause, high blood pressure. It can impact on the person, it can cause stroke, it can cause heart attack. It's just horrible. So we've got to deal with that. And not only primary smoking, even secondary smoking. Secondary smoking is even worse. Secondary smoking is, somebody is smoking beside you and you are just inhaling it. If someone is smoking around, please walk away from there. Respectfully walk away so that you don't become a secondary smoker. All right. The risk that primary smoking carries, okay, secondary smoking carries it as well. So please, we've got to deal with that. Type A personalities. These are people that are very aggressive, short temper span. They don't rest. They just, they have very aggressive, nature. And, yes, they may be very, very productive and very, active, but then, When that happens, the sympathetic drive is so high, stress level increases, and their blood pressure increases. High saturated fat diet, low birth weight. Okay, and this, I'm very, very, passionate about this. Low birth weight. What low birth weight brings is very, very unfair, so to speak. What it means that the child that is just about to be born, or the child that was just born without his own making or our own making, is already skewed towards developing hypertension. Because when people, those who are born with low birth weight, they tend to have very high vascular reactivity. Their blood vessels tends to constrict very, very, forcefully, and it responds very, very um, exaggeratedly to salt. Okay, to salt content, salt load, to stress, and so many other things. That's one. Two, sometimes their kidneys are not fully developed, and the kidneys, undergo things that can predispose it to developing hypertension. I won't bore us with the medical undertone of it, because that's not what we're really discussing about today. And I mean, this is not a medical class anyway. And then environmental pollutions. And environmental pollutions, noise pollution, air pollution, these are things that drive hypertension. And I mean, if you look at our nation, for example, the danger, and the danger that, inhaling the exhaust, the fumes of generator brings to our society, is very, very frightening. It will not only cause respiratory problem, it can cause cardiovascular problem, can increase, blood pressure. All right, it can destroy the endothelial functions. Okay, and then cause increased constriction of the blood vessels, and that can raise the blood pressure. Same thing with noise pollution. All right, noise pollution aggravates a lot of things. All right, it increases sympathetic drive. All right, adrenaline, noradrenaline will be released. And when that is done, the heart begins to beat very fast. When the heart beats very fast, the cardiac output will increase. All right, heart beats very fast. The volume of blood being pumped out will be fast, will be much, and then the cardiac output increases. Not only that, the vessels constrict, and that will bring about increased blood pressure, because blood pressure is cardiac output times peripheral resistance. So if the heart, the heart is pumping so much, pumping much more, and then the vessels are constricted, the blood pressure will go up. These are things we've got to deal with. So beyond the numbers, I want you to look at the ones that you are exposed to, the ones you are at risk of, so that you're not just measuring the blood pressure. Measuring blood pressure is good. I mean, if you are around for the last episode we had in May during the World Hypertension Day, I mean, one of the things that we talked about is how to measure your blood pressure correctly. So I'm not downplaying measuring blood pressure. I'm not downplaying looking at, what you need to do, to assess your blood pressure level. No, but I'm saying that beyond measuring your blood pressure, check some of these things, stick them. Ones are your own personal risk factors, and then you can deal with them. And if you have hypertension, you can begin to, deal with the drivers, the risk factors, because when the risk factors are there, even if you use yours, if you don't, that's why we talk about lifestyle modification. We're going to deal with that maybe in the next episode. Okay, beyond the numbers part 2. Okay, if you don't deal with the risk factors, you will your drug burden, okay, your pill level and your drug burden level will be high. There are people that are using 4 or 5 drugs, and their blood pressure is not controlled. All right, so we need to deal with that. Very, very important. So we're saying that check the factors that are related. For example, if you do not exercise, please, you need to start doing it. All right. During the next episode, we will also talk about tips to, increasing your physical activity. Okay, so these are things we need to deal with beyond the numbers. Look at these other areas, these things, these risk factors that are driving, you know, the the prevalence of hypertension worldwide. Not just driving the prevalence, driving, complications, driving, you know, the challenge of blood pressure control. Very, very important. All right. So over here you have it. Non-modifiable risk factors: age, ethnicity, black race tends to be, are more at risk of developing hypertension. Black race, those who are blacks are not only more at risk of developing hypertension, we develop hypertension earlier than, the Caucasians, at least 5 to 10 years earlier. The hypertension in blacks are very, very aggressive. The chances of complications are higher in blacks than Caucasians. So we are at risk, and we need to know that. All right. So ethnicity, genetics, we've talked about that. All right. And then gender. Gender, before menopause, males are more at risk of developing hypertension. By the time the woman attains menopause, the estrogen protection is lost, and then, the prevalence, the risk equalizes. But you and I know that that does not mean that, women don't develop hypertension before, before attaining the menopausal age. All right. What are the things that really drive this? So these are non-modifiable risk factors. I mean, if you are black, even if you change your skin, you still have the gene of a black person anyway. All right. If you are 70 years old, even if you do things, you know you're still 70. Hypertension increases with age. Some of these things you may not be able to deal with, but even with lifestyle modification, these are the modifiable ones. Even with lifestyle modification, the age can be affected, because if you eat right and you exercise and you do the things that you need to do, your biological age can be lower, far lower than your chronological age. And that these are the things we're talking about. So it can impact on not only your chances of developing hypertension, but your overall health, the quality of your health. All right, the quality of my health will improve when we decide to deal with the modifiable risk factors. So the modifiable risk factors: excess dietary salt intake, poor diet and obesity, increased, cholesterol, fatty laden or food. These are, modifiable risk factors. You can decide to cut down on salt, decide to cut down on saturated fats and the rest. All right, you can decide to cut down on fast food, excess alcohol consumption, lack of physical activity. You can decide to, start walking. There's something we call, just move your body, just move, just take a step, just move. All right. Now, you don't need to have 30 minutes at a stretch of, if you don't have that luxury of having 30 minutes at a stretch to do exercise, you can break it to 5 minutes or 10 minutes. We'll talk more about that, in the next episode. And then deprivation and socioeconomic status. Okay, those at the lower end because of the stress and so many other things that come into play, they are at risk of developing hypertension. Not only that, those are the upper end, all right, the very wealthy and the rest, I mean, civilization coming and all of that, they are also at risk because of their poor choices that they make. All right, very important. And then mental health and stress can are also modifiable risk factors. And here is also put, these are the modifiable ones, the personal ones, the non-modifiable ones: gender, age, race, family history. We've talked about that. And stress, smoking, salt, inactivity, alcohol, obesity. All right, these are things we can deal with. These are modifiable risk factors. So again, beyond the numbers, beyond checking your blood pressure, check some of these things. The ones you can deal with, start dealing with them. The ones you can check, start checking them, so that your chances of having good blood pressure is increased. Now, let me just talk briefly about salt, because I mean, it's something that cuts across everybody. I mean, if the food is not sweet, and one of the things that makes food sweet is the condiments, the salty stuffs and co. If the food is not sweet, nobody's going to patronize that, I mean, outfit. Okay, you may not enjoy the food. But then we're saying that it must be in a responsible way. Cut down on salt. Why? It can lead to endothelial dysfunction. The blood vessels on their own can, become dysfunctional at the endothelial level. And what will that do? It will cause vascular stiffness. The the vessels will not be able to dilate the way they're supposed to. And if the vessels don't dilate, they they become stiffened, the pressure will increase. Not only that, vascular sclerotization. I mean, there will be increased stiffness and hardening of the vessels. And what that will do is that, as it progresses, there can even be plaques in the vessels that will not only, so the vessels are not only stiff, the lumen becomes clogged, such that the pipe, if we take the vessel as a pipe, the blood flow through it becomes very, very dramatic. Excess salt can cause that, and before you know it, the organs will begin to get damaged. These are things that we need to deal with, we need to avoid, we need to prevent. And how do we do that? Cut down on your salt, intake. For physical inactivity, I mean, if you are not active, your the blood flow will reduce. Okay, so blood flow reduces, blood pooling increases, blood viscosity, that is the way with which the fluidity of the blood reduces, and it becomes clogged, difficult to flow, and that will increase blood pressure. All right. Now, when blood is not flowing well, chances of shear stress reduce. I mean, so when the blood is not flowing well, it becomes more viscous, and then blood pressure increases. Not only that, vasoconstriction, the vessels will constrict more. They become more stiffened. They stiffen earlier. They will not be able to dilate well, and then inflammation will begin to take place. All right, they will begin to age, the vessels begin to age, the heart begins to age. These are things that we've got to avoid by moving. So move more, walk instead of taking the elevator, take the staircase. By all means, try to walk, move, jog, run, do something. Keep your body moving. Very important. Natural history of hypertension: usually between age 0 to 30, we have pre-hypertension. All right. And some people will actually develop hypertension earlier. All right. I mean, develop it earlier. Some will even develop, we've seen patients who develop hypertension even before 20 years old. And they are not It's not secondary hypertension. All right. Although when it's that when hypertension is developed that early, we try to look for secondary causes. But for some people, they don't have any secondary cause. And then as it progresses, it gets established. If nothing is done with about it, if the patient is not diligent in taking his or her drugs and adhering to lifestyle modification, complications will set in. I mean, stroke, heart attack, and all that. It's not arrow. Some people, I mean, they suffer stroke. I saw a patient some time ago, I think about 10 years ago, thereabout. And when I asked him, say, "Oh, this thing happened to me when I had an arrow." I said, "Tell me about the arrow." And then he said that this and that, blah 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 blah. Then by the time they took him to the hospital, his blood pressure was 200 over 120. I said that was the arrow. There was no arrow shot at you. That was the arrow. You did not you weren't checking your blood pressure, and your blood pressure wasn't controlled. All right. Hypertension is just the tip of the iceberg. The blood pressure, the numbers are important, but that is not the only thing. It's just the tip of the iceberg. Beneath the major things. And that's why we said that hypertension is, beyond the numbers. Let's look at some other things. We're going to stop here for today. We'll continue during the next visit. That will be during the next during next month. All right, it's a monthly program. You will get notification about it. We will stop here for today. I've even overshot my time because we try to give 25 minutes for discussion. But let me quickly stop here so that we can entertain questions. Thank you very much. I hope you have gained, learned one thing or the other. If you have questions, you can raise up your electronic and or put it in the chat box. Thank you. Host, can you help me unmute Dr. Donye, Dr. Adekolade, Dr. Bailey? Um, I'm trying to see all the cardiologists on the floor. If you have questions, please raise your electronic and you'll be given the opportunity to ask your question. And you can also put it on the chat box. Thank you very much. Questions, comments. You have questions, you can raise up your electronic and okay, what's your position on taking coke? Let me see. Okay, there are quite a number of questions on the chat box. Dr. Dai, okay, let me just quickly run through the questions. I'm not sure I'm seeing any hand raised up, so we'll just run through the questions on the chat box so that we can close. All right. Okay, so what quantity of salt is considered excess? What's the maximum salt consumption per day? Okay, good question. Now, the way I explain to people, I mean, in a nutshell, is that as much as possible, we'll talk of 3 grams, per day. But the way I explain it is as much as possible when you cook such a way that your taste bud is not able to appreciate the salt content, the salt level in that food. The moment you begin to appreciate salt is in this food, okay? It's already becoming excessive. All right. So if you can limit it, that's the most practical way I can give it to you. Sometimes we talk of one level tablespoon. All right, you put it, and of course, for that, it also depends on what you're cooking. So, for example, if you're cooking Indomie, if you're cooking any of the noodles, there are people who put one sauce for one. Noodle pack. That is for me. That's extremely salty. So you can use one sauce for five, Indomie or noodle packs. All right, whether it's Indomie or any of those other ones, any one of them. All right, but some people do one for one. Okay, that will be extremely salty. You need to cut it down. I mean, I'm saying this because you know I've cooked one for five before. I cook five and then put one sauce, and it is still sweet. So I wonder how people are able to eat one for one noodle pack for one sauce. You are just simply consuming salt. You are not eating noodle, you are eating salt. So the practical way I will put it is, do it in such a way when you put salt in your food, let it be such that your taste bud cannot appreciate it. That will go a long way to qualify as some form of reduced measure. Because if I say, oh, 1 teaspoon or one this or one that, it also depends on the quantity of what you are cooking. All right, for example, the noodle stuff that I talked about. Okay, the noodle sauce is very small, but it's much. One for two is too much. One for three is too much. One for four, one for five, maybe reasonable. All right. So, in such practical means, something that your taste bud cannot appreciate. Okay. All questions. Okay, fine. Um, Sorry. Second question. I once read of a cardiologist that the harm effect of salt is exaggerated. Is it true? Well, I don't think a cardiologist will tell you that. Salt is a potent. Salt is good. We're not saying that salt is not good. And we're not saying no salt. We are saying low salt. LOW, not NO. Or again, I have those who want to move to the very extreme and say, doctor, I've cut, I'm not taking salt at all. They're not taking salt, they're not taking salty condiments. All right. So salty condiments like Maggi, the cubes, Maggi, Ajinomoto, and all of those stuff. They are not taking any of that. That is the extreme. It is not good because if your sodium and chloride is reduced, all right, that will not also help. Okay, so it's extremely important that we know that. Extremely important that we know that. So what we advocate is no low salt, not no salt. Very, very important. Now, what's your position on taking a bottle of Coke per week? Well, fizzy drinks are risk factors for cardiovascular disease. That's proven over and over. One per week. uh, I won't say that there's any major problem about that. You've got to assess your own cardiovascular uh, um, status or cardiovascular um, level. You've got to look at it. So, number one, are you very active? Number two, you cut down on your salt intake. Number three, your body mass index, is it within the normal or not? Because the fizzy drinks, Coke, Pepsi, any of them, they can also increase your body mass. All right. So these are the things you need to look at. All right. One may not be, may not be bad. I mean, uh, I can't tell you the number that you should take or that you can take. And then life is not supposed to be complete. It's not supposed to be boring. We are not here to make life miserable or boring for us. No. But we are saying that we need to, take ownership, because if we look at all the things we've talked about, 80% of them, 80% of cardiovascular risk factors are modifiable. So we can deal with the remaining 20. That's what we're talking about. Okay, what type of exercise does the person with high blood pressure need to do? I mean, um, there's so many. You can do brisk walking. You can, jog if you have the strength to do that. You can skip. You can dance. I was just still telling somebody yesterday. I said, look, I mean, if a person will say, "Oh, I have this, I don't have that." I said, you can dance. Don't When you're dancing, don't dance on the spot. Move around, dance. Put your favorites. I mean, music and dance. So there are so many, um, you know, so many exercises that can be done. You can ride bicycle if you know how to do it. You can engage in skipping if you like that. But we also say that do it to moderation, not the one that will now put you at jeopardy. No, we don't want you to exhaust yourself. Okay, we need you to do it within the level of your own cardiovascular strength. All right, don't do it to exhaustion, please. Very important. What's the normal blood pressure measurement for a man between his late 50s and early 60s? It is still 120 over 80 and below. Between um, 90 to 120 over 60 to 80. 121 to 139 over 81 to 89 is termed pre-hypertension for WHO. But if you are in the US, is to 129, all right? 130 over 80 and above is hypertension in the US. So I don't know where you're asking the question from. It is still 120 over 80, but hypertension is termed 140 over 90 and above for WHO. So if your blood pressure is 130, 125 over 70 over 80 is still fine. All right. Very important. Okay. Now, what fruits should people with hypertension not take? Well, there's practically no fruit that you cannot take. Practically no fruit that you cannot take. It's those with diabetes that have a bit of issues. We don't want, the sugary ones can make their blood pressures to go up. Okay, fine. So I think there's a few people raising up their hands. So please, apologies. Please, the person that raised the hand before, if you can raise it again, just try, and then you will be the host will unmute you. Please just raise your hand again, and then the host will unmute you. Okay, Adebisi, please go ahead.
Yeah, good
And
evening,
then
doctor.
Tinu Adetono. Please, host, help me unmute Adebisi and Tinu Adetono. Okay, please go ahead, please.
Good evening, doctor. Good evening.
Good evening, sir. Good
The
evening, sir. I
question
can
I
hear
want,
you, and I'm
yeah,
sure
the
everybody
question
can
I
hear
want
you.
to
Please go ahead,
ask,
sir.
the question I want to ask, sir, is a blood pressure of 128. My own blood pressure ranges between 127 to 130 over. It goes around 88 and 90. What can you say to that? It runs between that range.
Okay. One 130 over 88 and 90, right?
Yes, sir.
Can you mention the range again? Sorry.
As in between one about
Okay, fine. So
130 to 19. Let's say 90. Yeah.
okay. All right, fine. So 130 is okay. 90 has crossed the normal, the acceptable. 90 has moved to the hypertension range, really. So if you're having 90, 92, so if you have something like 130 over 90, 130 over 95, 130 over 90, 125 over 90 over 95 and things like that, you need to keep an eye on it. You may need to, I mean, some of these lifestyle modification we talked about, you may need to be a bit more aggressive with it to drive it down, because that 90-95 is also hypertension. This time around, the only thing is that it is isolated diastolic hypertension. Diastolic, that's the lower one. All right. For
Yeah.
So it's not until the upper one is elevated. The lower one can also be, the solely elevated one. And we say that this person has isolated diastolic hypertension. That is commoner in the younger, age group. Okay, before the age of, 55, 60, thereabout.
Mm,
All right. I hope that answers
okay.
your question, sir.
Yes. Thank you very much. I appreciate.
Okay. Thank you very much. Thank you, sir. Please, you're welcome, sir. You're welcome, sir. Please help unmute Tinu Adetono. Tinu Adetono, please, you can unmute your phone. Unmute and then you can talk.
Okay, good evening, sir. Good evening, doctor. Um, my own case is the lower one ranges between 75, 80 now. That one has come down to 75, 80, but the upper one has refused to leave 140, 142, and I take my drugs regularly. I don't know what is responsible for this. It's always above 140. It's either
Okay, thank you very
140,
much. So a number of things can be responsible.
132,
Number one,
or 142, at times 145.
all right,
But the
thank you
lower
very much.
ones
Now,
between the range of 75, 80 now. I don't know why the upper one has refused to
75,
come
80 now. Okay, so calm down. All right. What that may translate to is that your drug requirement is not enough for now. Okay, so you may need, more drugs. I don't know which. So you may need to visit your cardiologist to review your drugs. For example, if you're on one drug, you may need to put you on one other one to make it a combination, therapy. If you're on maybe two drugs at lower dosages, your doctor may need to increase one of the drugs, okay, to make sure that that blood pressure comes down less than 140. All right. Or if you are on the maximum, dosages of maybe two drugs, a third one may need to come in. Hypertension, more often than not, is not controlled with one drug. We talk of combination, therapy now, because the 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 routes to developing hypertension are very, multifactorial. All right, the pathophysiology. I'm trying not to use the medical terms. So
Okay.
pathophysiology is what we call it. But let me use this: the route, the inroad to hypertension are varied. All right, and we have different drugs that are channeled to address those areas, those entry points. All right, so you may need to meet your doctor, your cardiologist, to review you. That's one. Two, your lifestyle. All right, you may need to cut down on your salt intake. You may need to take more fruits. You may need to do more physical exercises to
Okay.
to help complement what your drugs are doing. I hope that
Okay.
helps.
Okay, sir. Thank you, sir.
All right, thank you very much.
Okay, sir.
Okay, I
Yes,
can't
sir.
see any more and so let's try and you're welcome, man. Let's try and get back to our questions. Dr. Donny, you're welcome back. I noticed that the network logged you out. What fruits? Okay, I think I've mentioned that. What fruits should people with hypertension not take? We've mentioned that. No one 129.90, is it okay? 129, yeah, is okay. 90 is not, because 90 is you already crossed to the hypertension zone. So if you have 129 over 90, 129 over 95, 129 over 92, almost every time, you need to do something about it. Lifestyle modification may help you to drive it down. And if it doesn't, then you may need to be commenced on medication. Can we have your contact? Okay, I think the contact is there. The admin, I mean, put in the contact. The social media is full of various alternative solutions to hypertension, usually leaves, roots, ginger, garlic, cinnamon. How true are these solutions? Has there been any scientific confirmation or otherwise of these solutions? Dr. Donye, can you help with this question, please? You're welcome back. Host, kindly help us unmute Dr. Donye. Host, kindly unmute Dr. Donye. Okay, I think the network today is a bit challenging. I don't know the reason for it. So let me answer it while it tries to unmute and get on board with the in the discussion. Where's that question again? Okay, fine. So leaves, ginger, and co. We talked about it. If you listen very well, we talked of things that are low in potassium, and we said those things that are low in potassium are mainly fruits and vegetables. All right, mainly fruits and vegetables. Now, yes, social media has been awash with some of these things, roots, leaves, ginger, and co. And they are right. Blood pressure can be reduced by ginger, can be reduced by garlic, by cinnamon. But number one, the dosage we don't know. Number two, it is not all blood pressure that are reduced by ginger and garlic and cinnamon. A number of people have made that mistake. They throw away their drugs, they start taking garlic, ginger, cinnamon, and they have very, very challenging, severe uncontrolled blood pressure. They come down with stroke, or heart attack, or heart failure, or kidney problem. All right. So we're not saying that you cannot take all of those things, but we're saying that number one, check your, of course, check your blood pressure regularly. And just like the other, person said, if you find out that your blood pressure is not controlled, don't keep it to yourself. Go meet the professional. Go back to your doctor. Let your doctor evaluate you again and put you on the proper drugs. These things, we are not saying that they cannot or they do not, reduce blood pressure. A number of them cannot control, blood pressure consistently. In fact, most of the people that this benefits more are those who use their drugs. That's true. Those who have pre-hypertension, those who, their blood pressure is just about crossing to hypertensive range, and then they hit the lifestyle modification button, and also they bring this on board to complement. I hope that answers your question. Um, what are the warning dangers to look out for in hypertension, particularly for people with a history? All right, that's what we're going to deal with in the next episode next month. But let me just quickly say that number one, hypertension can be largely asymptomatic. So if you are looking for symptoms, it may not show up, and that's why it's called a silent killer. That said, few other things, non-specific things can happen. So for example, somebody can be having a headache. You just find out that every time headache. You take paracetamol, it goes, and then in the next moment is back. The next day is back, or the person is not able to sleep well. All right, these are things that can, these are subtle presentations of hypertension before the major ones, like difficulty in breathing. By the time somebody begins to have difficulty in breathing, palpitation, chest pain on exertion and co, that person has really moved far, complications have started setting in. All right, so that's it. Hypertension is something that can be completely asymptomatic and can be very devastating. So the what we advocate is check your blood pressure regularly, especially if that's one. Okay, and then as we advance in age, let's check our blood pressure regularly, and it's not irrespective of anyone, really. I mean, it cuts across every social class, every social strata. All right. That's why we need to check regularly. Whilst on the treadmill, I pant and palpitate seriously even after. Should I continue or stop? You may need to see a cardiologist, please. We may need to do a proper regulated stress test, okay, exercise stress test for you. We may need to assess your cardiovascular, you know, uh, uh, your cardiovascular status, exclusively. We may need to do a very thorough cardiovascular status workup for you. Please, I will advocate that you see a cardiologist as soon as possible. And if you want to see us, the number is there on the chat box. You can call after this meeting. Is taking of high blood pressure medication a lifetime thing? Well, this is, again, we're not really talking about, treatment now. It's supposed to be the thought, but for the purpose of this question, let me just quickly answer it. Yes and no. For most people, yes, and emphatically so. All right, because most people, their blood pressure will not be controlled on ginger and garlic and cinnamon and banana and what have you. It will not be controlled. For most people, their blood pressure is not even controlled on one single drug. Just like what you heard about the participant that talked about our blood pressure always above 140, never going less than 140. So for such people, it is for life. And the way I say it is this: it is better to take the medicines and be healthy than not to take it and come down with cardiovascular complications. I mean, we don't want enough of stroke. We get more than 3-4 strokes per day sometimes in the teaching in the hospital. We want to put a stop to it. If we cannot stop it, we want to greatly drive it down. Because and unfortunately, it is the younger ones that are coming down with a 40 years or 45. I just saw a patient 26 years old, with stroke. It's painful. So we want to drive this thing down. All right. And one sure way by which hypertension can be controlled and complication can be mitigated is by, taking your medications. Very important. All right. Please, at what point do we, uh, what's the cause of palpitation after food in an hypertensive patient currently on valsartan and metoprolol? So many things can be the cause. You need to be evaluated. So you can call the number and or see your cardiologist. You will need to be evaluated. All right, so many things, and maybe you're taking caffeinated drinks and things like that. So many things can cause it. I won't be able to answer all of that now, but you need to see a doctor if that is happening to you, please. All right. Please, at what point should one start taking blood pressure medicines? When your blood pressure is consistently high, when you've been told that you have hypertension, okay, your doctor will start you on drugs. Please don't go on self-medication. Don't go on, my neighbor is using this, so I must use it. My brother is using this, so I must use it. Your genetic makeup is different from your neighbor's genetic makeup. Your genetic makeup is different from your brother's genetic makeup. Yes, you may have similar, but there are still differences. So what is working for your brother or your sister may not work well for you. Don't embark on self-medication. Consult a doctor, let the doctor help you, with the right prescriptions, and then that will be fine. What is the correlation between age and hypertension? Most especially reading the numbers. We've talked about it. As one ages, the blood pressure is likely to go up. All right. um uh, that's really what it is. And we need to just know that okay, you didn't answer my question. Heart enlargement, what is the cause? So many things can cause heart enlargement. Number one, a major cause of heart enlargement is hypertension. I mean, the topic we are dealing with today. So check your blood pressure regularly. If you have heart enlargement, it's already moved beyond. Okay, it's moved one step further. So you need to see a cardiologist to kindly, assess you. And if you need, to be treated, the cardiologist or the doctor you see, not really, I mean, affect the eyes in like making it dim or something. No, it will not. On the contrary, if you use your blood pressure drugs regularly and well, and your blood pressure is controlled, complications that hypertension brings to the eyes will not come up. All right, and the eyes will be spared. Please, sir, does high blood pressure medication have any side effect? All drugs have side effect, including paracetamol, including vitamin C, including Bico. All drugs have complications, but most of the drugs we give to our patients are very, very high safety profile and very low complication profile, so they are very safe. And if you have any issue with any, you can get back to your doctor. He or she will reassess you and then put you on the ones that will not give you any problem. What's the effect of eggs on cholesterol? Well, we know that eggs, especially the yolk, can increase the cholesterol level. How many is recommended in a week, fried or boiled? It depends on the cardiovascular status of the person. So I may not be able to say. It's not a one size fits all, answer. What is the effect of taking water and people living with hypertension? Water is good. I mean, water, 70% of our body composition is made of water. Okay, but water cannot treat hypertension, because some people will say very early in the morning, drink 2 liters of water or 3 liters and your blood pressure will be controlled. That is a lie. That is not true for somebody with hypertension, right? So please let us be guided. Thank you very much. I think I've been able to rush through. Sorry, this is the latest we are closing. We're so sorry. We're closing this late. It's strictly 1 hour thing. By 8:04, 8:05 thereabout, we usually close. But apologies, we started a bit late today, and then we had so many questions. Apologies about that. Thank you for staying tuned. We'll have the next Beyond the Numbers Part 2 next month. It's a monthly meeting. We will send the flyers, the notification to us. You can get in contact with the person who invited you. All right, you can also join our WhatsApp group. Okay, the WhatsApp group is if you send a WhatsApp or a text message to any of the numbers that are being displayed on the chat box. Host, kindly help us. Okay, fine, so it's been displayed again. If you chat up or send a text message to any of those numbers, they can put you on the WhatsApp group. On the WhatsApp group, we send regular notification. We also send other things on the group. I mean, health matters, things that can help your heart health and the rest. okay, and we're able to also answer your health concerns, cardiovascular concerns, and all the rest. Thank you very much. I do hope that you got value for your time. We do hope that we invite somebody next week. I mean next month. Sorry, not next week. Next month, we will definitely get the flyers across to us. Apologies, I understand that so many people couldn't come in when we were 100. Oh, so sorry about that. The maximum number for capacity for up till today is 100 for the Zoom meeting, but then the YouTube link is also there. This is also live on YouTube. We will post the YouTube recorded version to us. Any of your contacts that wasn't able to get on board for this meeting because maybe the maximum capacity had been reached at the time, you can send the YouTube recording to them, and please our apologies to them. We will try to increase the Zoom participants, all right, so that we can get in more, so that more people can be able to join us. Thank you very much. Do have a very wonderful week. God bless you.